Welcome to Learn with Livanta, Medicare, the BFCC-QIO, and you. Livanta's podcast where we bring you up-to-date information about QIO services and the overall Medicare landscape. Livanta holds a contract with the Centers for Medicare and Medicaid Services as a BFCC-QIO, or Beneficiary and Family-Centered Care Quality Improvement Organization. BFCC-QIOs are contractors hired by Medicare to make sure that Medicare beneficiaries receive the care they deserve. All Medicare beneficiaries have a right to high-quality health care, and BFCC-QIOs like Livanta protect that right. There are three primary services that we at Livanta provide at no cost to Medicare beneficiaries. Medical record review, when a beneficiary wants to appeal their discharge from a hospital or the termination of Medicare coverage services in nursing homes or other settings. Medical record review when a Medicare beneficiary believes they received poor quality or substandard health care, and immediate advocacy, which is a service Livanta provides to help beneficiaries and their families when they're having problems with their care or Medicare covered services. This month's episode is themed around quality improvement and quality of care complaints. To begin, we're going to share a case study of Livanta's services in action and then move into a conversation with Jackie Buttaccio. The true-to-life story you are about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide at Livanta help to resolve barriers to care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated.
After my husband's heart attack a few months ago, he spent several days in the hospital and then was discharged home. He was doing well, and his doctor ordered home health services for him. I was glad to have him at home, but also I was very overwhelmed. He had to follow a new diet and exercise plan, several new medications, cardiac rehabilitation, and other appointments to keep track of. As his wife and caregiver, that meant I was just as involved in these changes because I wanted to make sure he stayed around for a long, long time. The home health agency contacted us right away and came out to perform his intake and create a care plan. They had several pages of notes, checklists, and copies of the medications my husband was now taking. I had these as well, which we were given before he was discharged. I thought everything was in order until a few days in, something on the notes that were left on our kitchen counter seemed off. I compared the prescribed doses of medications on the home health agency's notes with my own. They were not the same. I thought at first maybe I had made a mistake. I contacted my husband's doctor to double check. Unfortunately, my notes seemed to be correct, but the home health nurse's notes were not. At this point, I was concerned that other things may also be incorrect and that he may be getting the wrong dosage. We decided to end home health services at that time, as there were only a couple of days left anyway. However, although my husband was still doing well, I did not want the issue to go unaddressed. When we enrolled in Medicare, we worked with a counselor at the local state health insurance program office. As part of their enrollment package, they included flyers for Livanta. I called Livanta because I was concerned about my husband's medication. I spoke with a representative, and they helped me file a formal complaint so the issue could be reviewed. Livanta conducted a review of the medical records and the home health care notes. The Livanta physician determined that there were clear errors. The home health agency was required to participate in a quality improvement plan. I'm glad I took the time to report this issue to Livanta. Although we no longer needed the agency's services at that time, we may again in the future need home health care. And certainly, others in our community would as well.
I am excited to introduce to you Jackie Buttaccio, who we will be speaking with today. Jackie is a Senior Director of QIO Operations at Livanta. She is a certified professional in healthcare quality and has worked in patient safety and healthcare quality improvement for over 25 years. In addition to overseeing the QIO-related operations under the Beneficiary and Family-Centered Care Quality Improvement Organization contracts, Jackie helps to ensure Medicare contract deliverables and performance metrics are met and supports the continuous improvement of daily operational work processes. Welcome, Jackie, to the Learn with Levanta podcast. Super excited to have you on today for a conversation about quality improvement. I'd love to start things off with a simple question. What is quality improvement?
Thank you. That actually is a really great question. The short answer is that quality improvement, at its core is the science of process management. Where one of the key principles is, you manage what you measure. But I'd say overall, quality improvement is a systematic, structured approach, really entirely focused on identifying areas for improvement. And the ultimate goal, of course, is to enhance the quality of your outcomes or results. But in quality improvement in healthcare is especially important because we're focused on enhancing the safety and effectiveness of healthcare and care delivery. And one of the things I always remember about quality is that, we often say, every system is perfectly designed to get the results that it gets, which really highlights the importance of understanding and improving our systems in order to achieve our desired results. And I think it really emphasizes that outcomes are a direct result of a system structure and design, whether it's intentional or not.
Livanta is a BFCC-QIO, and part of that abbreviation is Quality Improvement Organization. Could you tell us a little bit more about what makes a quality improvement organization?
Yes, in fact, I get this question a lot. And it's not a simple answer. The QIO program rather is one of the largest federal programs dedicated to improving health and healthcare for people with Medicare. The program is led by the Centers for Medicare and Medicaid Services, otherwise known as CMS. It was signed into law back in the early 1980s under the Social Security Act. The core function and foundation of the program really boils down to three important activities. Protect the integrity of the Medicare Trust Fund, which is, ensuring that Medicare only pays for services and goods that are reasonable and necessary, and that they're provided in the most appropriate setting. And also to protect Medicare beneficiaries, by addressing their complaints and protecting Medicare beneficiary appeal rights. And then lastly, to use data to track healthcare quality, working towards healthcare improvement at the local level. And I'd say that, to help Medicare do these important things, the QAO program has two key initiatives: the Beneficiary and Family-Centered Care QIO, or a BFCC QIO program, and the Quality Innovation Network QIO, or a QUIN QIO. And a BFCC QIO, the Beneficiary and Family-Centered Care Organization, is essentially made up of two organizations who are contracted with Medicare and work to serve and protect Medicare beneficiaries across the country. While a QUIN QIO is a group of, a dozen or so organizations that are also contracted with CMS, but work primarily with providers to improve outcomes in a variety of quality measures. Now, and as the program grew over the years, Medicare has added some additional entities that kind of folded into the QIO program. We have Hospital Quality Improvement Contractors, or HQICs. We have the American Indian Alaska Native Initiative. And then lastly, the Opioid Prescriber Safety and Support Initiative, which was designed to help combat the opioid crisis. But, the real big difference that separates the BFCC and the QUIN QIO programs is that the BFCC primarily works with beneficiaries to protect their rights to quality health care and their right to appeal certain decisions about their care, while the QUIN QIO primarily works with providers in the local community.
So, as you sort of alluded to, the work that we do here at Livanta primarily falls into the three primary services that we provide: um, appeals, immediate advocacy, and then quality of care complaints. Can you tell our listeners a little bit about what quality of care complaints are?
At Livanta, we operate as a BFCC QIO. So in addition to protecting a beneficiary's right to an appeal or immediate advocacy, we also accept and process formal quality of care complaints for Medicare beneficiaries. And this means that when a beneficiary or their representative feels their care that they received was substandard in some way, they can call the BFCC-QIO to examine their case.
Could you walk us through a little bit about what that process looks like from initiating that process to getting a result?
It can be a lengthy process, but it's important one that each step is really taken very carefully. So a quality of care complaint is a case review process ultimately. Typically, it's initiated by a written or an oral complaint from either the Medicare beneficiary or their representative, someone who they claim to be their rep. When Livanta receives the complaint, a member of our team requests the medical records from the provider or providers. It could be more than one, wherever the patient was receiving care, because maybe it's about the physician, maybe it's also about the facility, right? And so it could be, more than one complaint about more than one provider in a particular incident. The provider or providers will have 7 days to respond to our request for medical records. And although, if it's necessary, we can grant them up to 14 days to get us the records. But once we receive the records, a review nurse hired by, Livanta, part of Livanta staff, will review the case and identifies what we'll call the standard of care for the specific circumstances of that patient, and then prepares that case for a physician reviewer. The physician reviewer will then review the complaint and all of the submitted medical documentation, and then determines whether the services were either, whether they met or did not meet what we call professionally recognized standards of care. And if the patient does not agree with the physician reviewer's decision, the patient or their rep can ask for what we call a reconsideration, where the case will undergo the same process, but it would go to a separate and different physician reviewer, right? So it would, undergo the same process, but under a different physician reviewer. And then, anytime a quality of care concern is confirmed through this process, some type of educational activity will always occur, either from Livanta directly with the provider, or the case can be referred to the QIO that I referred to earlier. And the QIO would work with the provider on, developing and implementing an improvement plan with them. And then I should say, lastly, if a concern is determined to be, gross and flagrant, it can become subject to a sanction, which is a financial penalty that the provider would then pay for.
So much like the story that we heard earlier in the podcast, could you sort of tell us maybe an example or two of what a case of quality improvement could look like using the systems that are in place with Medicare?
For instance, oftentimes patients are told by their, managed care organization that it's time for them to be discharged and that they will be, going home. And oftentimes patients feel that they're not ready to leave the facility. As a Medicare beneficiary, a patient has the right to appeal this decision. So it's a really important, right to protect. Not everyone understands that they have that right. So as these decisions are being made for you, you can appeal these decisions as a Medicare beneficiary. And Livanta is one of the two organizations that will send the case to an independent physician review, to review the patient's medical records and determine if, he or she agrees with that notice. There's also, in a quality of care complaint example, we also, often see, patients who are reported, maybe, in one example, we wrote a story recently about a patient that was reported, she was admitted into a hospital for treatment of sickle cell crisis. And that her pain wasn't treated, adequately. She was discharged home with, continuing symptoms, and later filed a formal complaint with Livanta about her care. The physician reviewer reviewed her medical record to determine, was the patient's pain assessed and treated appropriately. And in this case, the Livanta physician reviewer suggested that, had the provider utilized a more multidisciplinary approach earlier in the patient's hospital stay, that the patient would have had a more rapid and effective pain management control regimen that could have been applied. Certainly the patient would have been happier and had, increased patient satisfaction, but it ultimately could have contributed to a more successful outcome for the patient. And so ultimately, that's what we're really driving at with these types of cases.
Absolutely. So to dive a little bit deeper into that, can you just tell me, what measures look like to improve quality care generally?
And they really can vary. So a quality measure can vary depending on its focus, right? So a hospital might measure the recognition of sepsis and how timely patients are treated with all of those, life-saving therapies and interventions. While here at Livanta, that looks a little different, right? A quality measure for us is one that's tied to our to the timeliness of our Medicare appeal cases. So in other words, how quickly we return a decision from a physician reviewer once we receive the medical record. In this case, there's a numerator and a denominator, which is used to determine the rate of timeliness. So in this example, the numerator would be, the number of appeals completed within the required time frame, and the denominator would be the total number of appeals that were even eligible for review in that same time period. And then, you do the math, divide them and get a rate and to determine whether you're in compliance or not. And so quality measures are important in terms of helping us understand how we're performing in those systems.
Jackie, thank you so much for taking time today to discuss quality improvement with me. I'd like to give you this opportunity if there's anything else that you'd like to discuss or share about quality improvement or the services that we provide here at Livanta.
Well, I think I'd just like to underscore, that quality is really one of Levanta's core values, and it's built into the program at every level. We're always looking for ways to improve our performance. We ensure our processes and our systems are as effective and efficient as possible. Which in turn helps the beneficiary and ultimately reduces cost and burden to the system. And that's something I think that we all can be proud of.
For more information about Livanta, including where to sign up for our monthly publication, The Livanta Compass, and to find your state or territory's helpline number, visit our website at www.livantaqio.cms.gov. That's www.livantaqio.cms.gov.